So part of implementation of the national strategy with regard to how we reach these goals is implementation of the Affordable Care Act. What a transformative piece of legislation, what a transformative law. We stand at a moment of history here, and we're in the end zone with regard to beginning implementation. The Affordable Care Act will expand coverage to about 30 million Americans. This includes 9 million Latinos and 7 million African Americans, the populations most affected by HIV in this country. And already millions of Americans have increased health coverage due to the Affordable Care Act. Now in January of 2014, when open enrollment starts, we'll continue to see major changes. There are so many, but one of the main ones I think that we need to continue to talk about and to inform our consumers, our patients, our families, our loved ones, is that because of the Affordable Care Act, insurance companies will not be able to deny coverage based on pre-existing conditions, including HIV. How many of you have had that conversation with people, right? I mean, I'm a provider. I've had conversations. I don't want to get an HIV test because if I'm positive, I'm not going to ever be able to get insurance. That is done in just a few months. Huge. It's huge stuff. HIV testing will be covered without additional cost sharing in new health plans. So these are transformations, but there will still be gaps. Some people will not be covered by the Affordable Care Act, and some states are not expanding Medicaid yet. And there's also likely to be ongoing need in other areas. 70% of people who are on the Ryan White program, for instance, already have health care coverage, suggesting that the need for Ryan White services will continue even among people who gain health coverage. Also, with more people entering the healthcare system who are either already diagnosed or diagnosed because of HIV testing, there will be an ongoing need to serve these folks. So we'll have, if we reach the goals of the National HIV/AIDS Strategy, as we reach the goals of the National HIV/AIDS Strategy, more people are being diagnosed, more people are ongoing medications, there's going to be an increasing need to expand the capacity to serve the people who are coming into the system. So to meet the goals of the national strategy, we need to realize the synergies that the Affordable Care Act presents, while being mindful of a focus on evidence-based interventions and reaching the populations most affected by HIV. So joining me today to have this conversation are some of the most senior US government leaders, colleagues, and friends who are working together across federal agencies to improve the nation's response to the HIV epidemic. I also want to acknowledge that leadership, our leader from the NIH is here, Dr. Jack Weitzcarver. Jack, you know. And as you know, the national strategy calls for a coordinated response across different federal agencies, including the Department of Labor, and I believe Dylan Orr is in the audience as well. He's been one of our main leaders at the Department of Labor with regard to implementing the strategy. Dylan, are you? So now let's talk. Our first panelist is a friend and colleague, Dr. Jonathan Mermin from the CDC, where he's CDC's lead voice on HIV and AIDS. And Jono, thank you for being here today. And I'm going to be asking you and the other panelists the same two questions. What are 3 action steps CDC is taking to get ready for enrollment? And I'll just add, I can repeat the second question because I know you're going to have a great answer to the first one, but just for now so you know what's coming. What aspects of the Affordable Care Act do you think are critical for your grantees and most important with people living with HIV?
Well, thank you, Grant, for your insightful questions, and also Paul for inviting me to USCA. It is the Super Bowl of conferences, and it's really a pleasure to be here and to learn and meet with people. I also wanted to thank you for giving us the questions in advance. And although we were only allowed 2 slides, I made 3, because I wanted to start in partial answer to the first query with a single background slide that shows how the HIV epidemic continues to be a major public health problem in the United States, and one that is growing. Today, about 1.2 million people are living with HIV, and the number of persons living with HIV, shown in red in this slide, has increased 60% in the past 15 years. Each year, there are about 50,000 new infections and about 20,000 deaths among people with HIV, a net increase of about 30,000 people each year. This is good news, since it reflects improved diagnosis, care, and treatment. However, it presents a challenge for prevention, as a stable incidence, shown in blue and yellow on the bottom of the graph, and effective treatment result in an increasing number of people with HIV who have the potential to transmit the virus. The epidemic itself calls out to us that we need to do a better job faster, because the window of opportunity is closing. But this is true at the same time that the theme of this session, the Affordable Care Act, provides us with some of the tools and opportunities to meet the challenges we currently face. So in response to Grant's first question, in this slide I highlighted 3 activities with which CDC is involved that take advantage of some of the changes in the healthcare system, in addition to encouraging our partners to help clients and patients with enrollment in the healthcare marketplace. None of these can be fully understood without appreciating the fact that 2 years ago, HHS, HIV treatment guidelines, changed to become the most proactive in the world. Antiretroviral therapy is now recommended regardless of CD4 cell count, as Dr. Colfax had emphasized. And this recommendation incorporates both the clinical and the prevention benefits of ART, and cements in writing the recognition that HIV prevention and HIV care are intertwined and synergistic. So the first activity relates to a fiscal year 2014 $40 million budget redirection from Congress that will increase health department and potentially community-based organization capacity for reimbursement and billing of services such as HIV and STD testing, and will increasingly focus CDC funding on evidence-based interventions that will have the highest impact on the epidemic. The second is the Secretary's Minority AIDS Initiative Fund-supported Care and Prevention in the U.S. funding announcement. This is an $11 million a year collaborative pilot program across all HHS agencies, or at least the ones represented here on this podium. And it uses health department surveillance data and personnel, clinic staff, patients, and other organizations connecting each other to ensure optimal testing, linkage, retention, and treatment in 8 different states. And those states were the ones that needed it the most. The third activity is an upcoming comprehensive set of HIV prevention and care recommendations for persons with HIV that were developed jointly by CDC, HRSA, and multiple other agencies and organizations, as well as people living with HIV. And these guidelines explicitly integrate prevention and treatment and take a holistic view of health and prevention. The second question that Grant asked relates to aspects of the Affordable Care Act that are critical for CDC's grantees and people living with HIV. The first is that the Affordable Care Act states that preventive services rated A or B by the U.S. Preventive Services Task Force will be covered with no copay by Medicaid expansion plans and most private insurance plans. This means that HIV screening for people aged 15 to 64 years and more frequent testing of persons at increased risk for HIV, as recently recommended in alignment with CDC guidelines, will be reimbursed. Our task is now to expand HIV testing to those who need it now that financial barriers are lessened. The second is that behavioral counseling for STD and HIV prevention received a Category B rating by the task force, and that should allow reimbursement for some of the behavioral interventions that are the mainstay of HIV prevention. In relation to CMS, Medicaid's new final rule defines preventive services as services recommended by licensed practitioners, a potential opportunity to expand reimbursement for non-clinical providers. In other words, people who are not doctors or nurses, both inside the healthcare setting and potentially outside of it, such as community-based organizations. And lastly, we're collaboratively working with HRSA and others on an HIV screening measure to submit for meaningful use, and have already positioned several clinical measures for the same. And these measures, which are elected to be used by health clinics and providers, allow an opportunity for both measuring progress on the most important indicators of success, as well as supporting changes in clinical practice. So those were my responses to the questions, and thank you, Grant.